Okay, so this is Part A. Okay, so in healthcare, you're going to have various specialty areas. These are on the screen for you. We're going to talk about each one of those individually. Okay, long-term care is usually given to chronic type patients. They're usually offered in skilled nursing facilities of some sort. Skilled care is available 24 hours a day, given by a nurse or a therapist. It includes several different types of specialty areas such as long-term skilled nursing facilities, rehabilitation, and extended care. Home health services are given in the home. They're usually given to people that are chronically ill, but they want to be at home. They don't want to be in a facility. People who receive these services are usually referred to as clients. Assisted living. Most people that live in an assisted living do not need 24-hour care. They just need a little help here and there. The residents may live in a single room or apartments, and they may have memory care units for those that have mild dementia. Adult day services are for people that need assistance and supervision during certain hours. It may provide a needed break for caregivers. People do not live where care is provided. An example of this would be if your caregiver works another job away from home, they may need to take their mother, father, son, daughter, next door neighbor, whoever it is they're caring for, they may need to take them somewhere else while they work at their job. And that's where these adult day services are very handy. Acute care is 24-hour skilled care given in hospitals and ambulatory surgical centers for people who require short-term, immediate care for illnesses or injuries. People are also admitted for short stays, sometimes with acute care. Subacute care is in a hospital or a long-term facility. It's used for people who need less care than acute, but more than for chronic illness, and treatment ends with stabilization. Outpatient care is given for less than 24 hours. It often includes short-term care and surgeries. Rehabilitation is care given by a specialist to help restore or improve function after an illness or injury. Different kinds of rehab would be physical, occupational, and speech therapy, and those help improve the function. Hospice care is given to people with 6 months or less estimated left to live. Physical and emotional care are provided to families and clients. So when you think of hospice care, don't think that you're just taking care of the person. A lot of hospice care is involving their family as well. Okay, so the healthcare team may be different than what you see that day. Um, this is a few people that may be members of that team. Of course, there might be more or there might be less. So we're going to talk about each of these individually and let you see what those abbreviations mean. So your CNA is a certified nursing assistant. They perform tasks, assist with routine personal care. They usually have at least 75 hours of training. Um, some states may require a little more than that. They are the eyes and ears of the team. They observe and report. You're a licensed vocational nurse or a licensed practicing nurse. They have 1 to 2 years education. They pass the licensing exam. They supervise the CNA and administer medications and treatments. The registered nurse is an RN. They have 2 to 4 years education, a college degree, and a licensing exam, treatments and medications, and they may supervise as well. Nurse practitioners may diagnose and prescribe medications. They evaluate patient conditions, and they are under the supervision of a doctor. Medical doctorate. They diagnose diseases and prescribe treatment. They have 4 years medical school and may specialize further, such as cardio or pulmonary, which is the lungs. There are different specialty areas in that as well. Okay, so your physical therapist will evaluate a person and develop a treatment plan to help with their movement, circulation, reduce pain, promote healing, prevent disability. There's a lot of different things involved in that. Occupational therapy, or OT, they have a minimum of a master's degree. Help residents learn to adapt to disabilities, often involves assistive devices, national certification exam, and licensed within their state. Okay, so you have an SLP, which is a speech language pathologist. They have a master's degree and they're licensed or certified. They identify common disorders, develop a plan of care, and have exercises that improve speech problems. They also evaluate the ability to swallow food and drink. Next, we have the registered dietitian. They create diets for residents with special needs, may supervise the preparation of food. They have a bachelor's degree and they're licensed or certified. Medical social workers determine needs and help get support devices arranged. They help obtain personal items. They may book appointments and transportation. They have a master's degree in social work. Activities director. They plan activities for residents to help socialize and stay mentally and physically active. They maintain well-being and prevent further complications. The bachelor's degree, associate's degree, or qualifying work experience. May also be called a recreational therapist depending on education and experience. The resident part of the care team would be that the whole team revolves around them. We don't have a team without the resident, and they make decisions about their care. The chain of command help protect nursing assistants and their employers from liability. The medical chain of command, an example of that here would be a CNA, LPN or LVN, RN, charge RN, unit manager, nursing supervisor, a minimum data set coordinator, or a resident assessment coordinator, assistant director of nursing, director of nursing, medical director, and administrator. Okay, so HMO requires that participants use a particular doctor or group of doctors except in an emergency. And a PPO, networks of providers that contract to provide healthcare services to a group of people. Employees are given incentives to use network providers. A person in PPO may still receive healthcare outside of the network providers, but must pay a higher portion of the cost. Managed care, which is a cost control strategy, is focused on getting sick people well in the quickest, least expensive way possible. Medicare will only pay for care that it determines to be medically necessary. Okay, and your references there are your textbook.